Have you ever come home at the end of the day, taken off your bra, and just sighed in relief, like you've been carrying something heavy across your chest all day, and you didn't even realize it? Maybe you've told yourself it's just part of getting older. That's just how things feel now. Right? But what if? What if that pressure, that discomfort, that lingering ache isn't just age creeping in? What if it's your body whispering something to you? Something important. Something your doctor wishes you'd notice before it becomes a bigger problem. You see, for women over 65, wearing a bra isn't always the comfort or necessity we were led to believe. In fact, doctors are starting to speak up, and their message is clear: your bra could be doing more harm than good. I know, that might sound surprising. Maybe even a little uncomfortable to hear. Because for decades, you were taught to wear one. Taught it was proper, or supportive, or that it helped you look put together. But here's what no one told you: your body, it changes with age. Your skin thins, your muscles shift, your nerves become more sensitive. And something as ordinary as a bra? It can start causing issues that many women never think to connect to it: shoulder pain, poor posture, rashes, even shortness of breath. So let me ask you something from the heart. How many times have you put up with discomfort? Just because it's what you've always done? How many days have you ignored that pinch in your back, that tightness around your ribs, or those red marks on your shoulders? Not because it's okay, but because you've gotten used to it? And maybe no one ever told you that you don't have to live like that. Not anymore. This video is for you. For every woman who's ever taken off her bra at night and thought, why do I even wear this thing? Because today, we're uncovering the 10 subtle but serious signs that your body is begging you to stop wearing a bra after 65. Some of these signs might seem small, but they can reveal a lot more about your health than you realize. So, please, don't just shrug it off. Don't wait until that ache becomes chronic pain, or that irritation turns into a rash that won't go away. Stick with me, and by the end of this video, you'll know exactly what to watch for. And most importantly, what to do about it. Comment, "I'm listening," if you've ever felt sore or uncomfortable in your bra and weren't sure if it was normal. I want to hear from you. And if you care about your health, your comfort, and your peace of mind, make sure to like this video and subscribe to Elderly Wisdom Guide. This is your space, a place where your well-being comes first. Let's dive in. You might be surprised at what your body has been trying to tell you all along. Let's start with something subtle, but serious. 1. Persistent shoulder grooves. Take a moment and think about this. Have you ever taken off your bra at night and noticed those deep, red grooves pressed into your shoulders? That's exactly what happened to Helen, a 68-year-old retired teacher who had been wearing the same style of bra for over 30 years. She thought nothing of it at first. Just the usual marks, she'd say, brushing it off with a tired smile. But as weeks turned into months, those grooves didn't fade like they used to. They became permanent, etched into her skin like scars she didn't remember earning. She chalked it up to aging. But when she mentioned it during a routine checkup, her doctor leaned in and said something she hadn't considered: "Your bra is doing this to you." You see, as we age, our skin becomes thinner, more fragile. We lose collagen, elasticity, even some of the protective fat under the skin. What used to feel like normal pressure in your 40s, becomes damaging in your 60s and beyond. The tight straps that were once tolerable now dig in, cutting off circulation and even compressing delicate nerves near the shoulder. And over time, that pressure can lead to pain, numbness, or even inflammation you might mistake for something else. But here's where many women go wrong: they assume it's just what happens with age. They think, well, this is just how it is now. No, it doesn't have to be. You're not weak. You're not fragile. You're just wearing something your body has outgrown the need for. The good news? There are options. You can try switching to soft, strap-free bralettes that don't dig into the skin, or go completely braless when you're relaxing at home. Give your skin room to breathe. Let your shoulders feel light again. And believe me, your body will thank you. And it's not just your shoulders, your back might be taking on more than you realize. 2. Chronic upper back pain. Let me introduce you to Maria. Maria is 70, energetic, full of life, but she kept complaining about this dull, dragging pain right between her shoulder blades. She thought it was her posture. Or maybe arthritis. She'd tried everything, stretching, massage, even over-the-counter pain meds. But the discomfort lingered. Then one day, on a whim, she spent the afternoon without her bra. And for the first time in months, she felt relief. What was going on? Here's the truth. As we get older, the muscles that support our upper back naturally weaken. It's a normal part of aging, but when you add a tight bra band or underwire to the mix, it only makes the strain worse. Those straps pull your shoulders forward. The band squeezes your ribs and tugs at your back. Before you know it, your posture changes, and not in a good way. Now, most women assume the pain is from aging joints or past injuries. But often, it's the bra that's adding unnecessary stress to muscles that are already tired. Doctors see it all the time, back pain in older women who don't realize their undergarments are making it worse. And let's be honest, some of those bras we wear, they were never designed with older bodies in mind. They're stiff. They're tight. They pull in all the wrong places. So, what can you do? You don't have to ditch support completely. There are gentle alternatives. Posture-friendly tops, light camisoles, and even supportive yet soft fabrics that ease the load without sacrificing comfort. And if back pain is a regular visitor, don't be afraid to ask a physiotherapist what kind of support garments might actually help. Sometimes, removing your bra for a few hours a day can make a difference you feel right down your spine. And speaking of pressure, have you noticed your breathing lately? It might be connected in ways you never thought about. 3. Shortness of breath or chest tightness. Now let's pause for a moment and talk about something many women chalk up to age or nerves, but could actually be caused by something as simple as your bra. Joan, a lively 72-year-old and grandmother of 4, told her daughter one day, "I don't know why, but I feel like I can't take a full breath anymore, like something's pressing on my chest all the time." Her daughter thought it might be anxiety. Joan thought maybe it was just her age catching up to her. But the real culprit? Her bra. You see, as women age, lung capacity naturally declines. The muscles around your chest and ribs become less flexible. And when you wear a bra that hugs too tightly around your ribcage, especially those firm bands or underwires, it doesn't just restrict movement. It can literally limit how much your lungs are able to expand. That constant, low-level compression around your diaphragm might not seem like much. But over hours, days, and years, it can make your breathing shallow, even uncomfortable. And the worst part? Most women never question their undergarments. They blame stress, or aging, or heart issues. But before jumping to conclusions, check this first: how tight is your bra band? Do you feel relief when you take it off? Can you breathe deeper when it's gone? If the answer is yes, then your body has already given you the message. It's time to listen. Try switching to looser-fitting tops or soft, breathable fabrics. Especially when you're resting or sleeping. You deserve to breathe fully, freely, and without restriction. And while we're paying attention to how your body feels, let's talk about something you may not expect: skin infections. 4. Skin irritation and rashes under the breast. Let's talk about Catherine. She's 69, active, and always on the go, but she started noticing this persistent redness under her bust. At first, she thought it was just a bit of heat rash. You know, maybe she was sweating more than usual. So, like many of us do, she reached for powder. Then creams. Then over-the-counter ointments. But nothing worked. Finally, during a visit to her doctor, the truth came out. It's your bra, the doctor said. And your skin is trying to protect itself. As we age, our skin becomes thinner, more delicate, and less capable of tolerating friction. Add a snug bra, a bit of heat or sweat, and what do you get? Chafing. Redness. Itching. And sometimes even yeast infections in the folds under the breast. It's uncomfortable. It's embarrassing. And worst of all, it often goes untreated, not because we don't try, but because we're only treating the symptoms, not the source. Many women fall into this same trap. They just keep applying powder or medicated cream, without ever questioning if the bra itself might be the issue. So, what's the better move? Choose bras made with moisture-wicking fabric. Look for cotton or bamboo blends that allow your skin to breathe. Better yet? Spend part of the day braless, especially when you're at home, resting, or doing light chores. Give your skin a chance to breathe, heal, and reset. Because the last thing you need is an undergarment making your skin feel like it's under attack. But the discomfort doesn't stop at your skin, it can run even deeper, right down into your circulation. 5. Numbness or tingling in the arms. Now let's talk about something that might have puzzled you before. Have you ever felt your hands go numb for no clear reason? Or maybe there's a tingling, like pins and needles, in your arms that just won't quit? That's exactly what happened to Diana. She's 73, sharp-minded, always active in her garden, but she started feeling this odd tingling down her arms, especially toward the end of the day. She thought it was nerve pain. Maybe arthritis. Maybe circulation. She even wondered, could it be something serious? Like my heart? She brought it up at a neurology appointment, half expecting a long list of tests. But the neurologist surprised her with a simple question. Tell me, what kind of bra do you wear? Diana blinked, confused. Her bra? What could that have to do with her hands? Everything, it turns out. You see, bra straps, especially narrow ones, can press down on the brachial plexus, a group of nerves running through your shoulder area. When these nerves get compressed, it can cause numbness, tingling, even weakness in your arms and hands. And the older we get, the less tolerant our bodies are to that kind of pressure. Here's the mistake most women make, they ignore it. They think it's poor circulation, or just aging. But in truth, it could be the daily strain of a too tight or badly fitted bra. Now, no one's saying to throw your bras away. But take breaks during the day. At home? Take it off. Going out? Wear something with wider, softer straps, or better yet, get properly fitted. You'd be surprised how many women wear the wrong size for years. Let your shoulders, and your nerves, breathe. And that brings us to something we often blame on everything except what we wear, posture. 6. Poor posture and slouching. Posture isn't just about how you sit or stand. It's about how your body aligns itself, every minute of the day. And Margaret, a lovely 76-year-old who still walks her dog twice a day, noticed something strange. Every time she wore a certain bra, she'd find herself hunched over more than usual. Slouching. Feeling stiff in her neck and lower back by evening. Her physical therapist noticed it too. He said, "You stand differently when you're wearing that. Your shoulders roll forward and your chest closes in. Why does this happen?" Many bras, especially ones with underwire or heavy padding, pull the shoulders forward. They create an unnatural tension on your back and neck. Over time, your muscles adapt to that forward slouch. And once your posture shifts, so does everything else, your balance, your gait, even your digestion. But here's the real twist, most women think bras help with posture. Support, they say. But the wrong kind of support can actually lead your body into misalignment. That rounded shoulder look that so many women struggle with in later years? Sometimes it starts with something as overlooked as the bra you wear every day. So, what can you do? Try replacing traditional bras with support camisoles. These smooth out your shape without pulling your shoulders out of alignment. Or consider a posture brace made specifically for seniors. It gently guides your spine into place without harsh pressure. Your body deserves to stand tall and proud, because you've carried so much, for so long. Now let's uncover something most people never connect to their bra at all: digestive discomfort. 7. Indigestion or acid reflux after wearing a bra. Now here's one most people never connect to their clothing: your digestion. Let's talk about Rita. She's 74, loves cooking, and still hosts Sunday dinners for her family. But she started noticing something frustrating. After every meal, she'd feel bloated, heavy, sometimes even gassy or nauseous. She blamed the food, of course. "Maybe I shouldn't have had the beans," she'd laugh. But over time, she realized something strange. On the days she wore her tighter bras longer, especially the ones with firm bands, her symptoms were worse. On days she went braless or wore something loose, no bloating, no reflux, no discomfort. So, what gives? As you age, your digestive system naturally slows down. Your stomach doesn't empty as quickly, and you might already be more sensitive to certain foods. But when you add external pressure, like a tight bra band around your diaphragm and upper stomach, you're literally squeezing your digestive organs. That gentle pressure might not seem like much, but it can push stomach acid upward, triggering reflux. It can make gas feel trapped. And it can leave you feeling full even when you've barely eaten. The big mistake? Blaming the food alone. Thinking, "It's just my stomach acting up." When really, it might be that snug elastic band digging into your midsection hour after hour. So, here's a simple solution: after meals, avoid wearing bras that have firm bands or sit tightly around your ribcage. Instead, opt for loose-fitting tops. Or better yet, take your bra off altogether and let your digestive system do its job without restriction. You'll be amazed at how much lighter and more comfortable you'll feel just by letting your midsection breathe. And if getting comfortable at night has become harder lately, your bra might be quietly stealing your sleep. 8. Disrupted sleep or discomfort at night. Let's shift to something deeply personal: your rest. Agnes, a 71-year-old widow, used to wear a sleep bra every night. She believed it offered support, helped with sagging, and kept her chest in place. But night after night, she'd toss and turn, waking up more frequently, feeling stiff in the morning. Even her dreams started to feel lighter, as if her body never truly sank into deep rest. Eventually, she started skipping the bra at bedtime. And almost overnight, her sleep improved. So why does this happen? Here's the thing: when your body sleeps, it needs total relaxation. Your blood flow needs to move freely. Your muscles, your lungs, your skin, everything needs space to recover. But when you sleep with a bra on, especially one with structure or seams, it can interrupt circulation. It can gently press on your lymph nodes. And that constant tension, while subtle, can keep your nervous system on alert. The myth that bras prevent sagging while you sleep? Let me gently say this: it's just that, a myth. Your breasts are made of fat and ligaments. Time and gravity do their thing, bra or no bra. And that's okay. You've earned every curve and every soft place. The real mistake is sacrificing sleep for the illusion of control. So, here's my advice: let your body be free at night. Ditch the bra. Wear a soft cotton sleep shirt or go bare under your covers. Give your body the peace it needs to reset, recharge, and truly rest. Because when you sleep better, you feel better. You move better. You live better. Now, let's touch on something that's often kept quiet, but deserves our attention: breast pain. 9. Tenderness or pain in the breast tissue. Let's now talk about a symptom many women ignore, because they think they have to. Patricia, 75, a retired librarian with a warm smile and a quiet strength, noticed something strange. Every evening, as she undressed for bed and took off her bra, she felt these sore little spots on her breasts. Sometimes on the sides. Sometimes underneath. She hadn't bumped herself. There were no visible marks. Just soreness. At first, she thought it was hormonal. Then maybe a side effect of one of her medications. But she never thought to connect it to her bra. Not once. Until her doctor gently explained, "Patricia, the pressure from that underwire, and the padding you wear daily, can irritate your tissue. Especially now, as your skin thins and becomes more sensitive. You see, our breasts don't just change in shape as we age. They change in texture, in density, in vulnerability. What once felt fine in our 40 may now feel like bruising in our 70. Even without any trauma. And yet, so many women keep wearing the same bras, with the same stiffness, the same tightness. Because, well, it's what they've always done. That's the mistake. Breast pain gets brushed off. Blamed on menopause. Blamed on the weather. But very often, it's that unrelenting daily pressure on tissue that just wants a break. So, what can you do? Choose seamless, wireless bras made of soft materials, no padding, no wires, no digging. Or better still, skip them altogether when you're at home. Because your breasts don't need to be held up when all they want is to relax. Let your body be soft. Let it feel safe. Let it feel yours again. And now, let's turn inward. Because sometimes, the heaviest discomfort we carry isn't physical at all. 10. Emotional fatigue from conforming to comfort norms. Let's talk about something few women will say out loud, but so many feel deep down. Elaine, 78, a lovely woman who volunteers at the local senior center, once sat quietly over tea and said, "I still wear a bra every day, but only because I feel like I have to. Not because it feels good. Not because she wants to. But because it's what's expected. Because it's what she was taught. Because it's what the world told her was appropriate." And that, my dear friend, is emotional fatigue. That slow, quiet exhaustion that comes from always doing what's expected. Even when it no longer serves you. Even when it hurts. Even when no one's watching. How many of us have worn something uncomfortable? Smiled through the pain. Because we thought, well, this is just how it is for women. Let me tell you the truth, after 65, after a lifetime of caring for others, of enduring, of showing up, you have nothing to prove. You've earned the right to choose comfort. You've earned the right to let go of outdated rules and rewrite what acceptable looks like. You don't need a bra to be presentable. You don't need one to be respected. You don't need one to feel beautiful, or whole, or dignified. If you still want to wear one, that's your choice. But it should be a choice. Not a burden. Not a rule. Not a mask. You are not here to suffer quietly for appearance's sake. Not anymore. So, take a deep breath. Put your hand on your heart. And ask yourself, who am I doing this for? If the answer isn't you, then maybe, just maybe, it's time to let that go. So, what can we take from all of this? Letting go of long-held routines, like putting on a bra every single morning, can feel like letting go of something bigger than just fabric and straps. It can feel like giving up a piece of your identity. The polished woman. The put-together version of yourself. The quiet strength you've carried for decades. But I want you to hear me clearly. This is not about giving up. It's about giving in to what your body truly needs right now. You've spent your life showing up for others. Working, nurturing, protecting, serving. And for all those years, you wore what was expected. You did what was expected. But now? Now it's your turn. This chapter of your life, this beautiful, wise, hard-earned season, is not about clinging to discomfort for the sake of tradition. It's about releasing what no longer serves you. You're not losing structure. You're not losing grace. You're gaining something far more valuable: freedom, comfort, relief, health. So, here's what I encourage you to do tonight, when you're getting ready for bed. Leave the bra on the dresser. Sit down in a soft cotton shirt. Breathe deeply. Notice what your body feels like, without the squeeze, without the pinch, without the tug. You might be surprised by how much more relaxed you feel. How much more yourself. Because small changes like that, tiny choices made with love for your own body, can quietly, powerfully transform your entire day, your entire life. You've carried so much, dear friend. Not just physically, but emotionally. You've held families together. Held yourself together. You've been strong when no one noticed, and soft when it mattered most. Now is the time to let go of what hurts. Of what digs into your shoulders. Of what tightens around your ribs. Of what no longer fits the woman you are today. And instead, embrace what brings you peace, ease, stillness, and joy. Because you deserve that. Every day. So, let's take a moment to reflect on what we've uncovered together. Today, we explored 10 important signs your body might be giving you, signs that it could be time to stop wearing a bra after 65. From those deep shoulder grooves and chronic back pain, to shortness of breath, skin rashes, numbness, and poor posture. All the way to the emotional fatigue that comes from wearing something just because the world expects you to. If any of these sound familiar to you, or remind you of someone you love, don't ignore them. Your body is always speaking to you. Sometimes in whispers. Sometimes in aches. And sometimes in those quiet, tired sighs at the end of the day when you finally take it off and feel free again. So, I'd love to hear from you. Which of these signs have you experienced? Or have you seen them in your mother, your sister, your friend? Please share in the comments below. Your words, your story, could help another woman recognize her own. And if this message resonated with you, if it opened your eyes or brought you comfort, please give this video a thumbs up. It helps others find it, and it shows us we're on the right path, together. And if you're new here, I'd be honored if you'd subscribe to Elderly Wisdom Guide. This channel is your space. A place for real talk, honest care, and simple, powerful ways to feel better and live wiser every single day. Because this stage of life, it's not about restriction or rules. It's about peace. It's about wisdom. And it's about comfort, in your body, your choices, and your journey. Thank you for spending this time with me today. Stay gentle with yourself. Stay curious. And above all, stay kind to your body. I'll see you in the next video. Until then, be well. Be free. And keep living with wisdom.